All right. Hello, everybody. My name is Seven Song, and this is a class about mental and emotional health or mental emotional health conditions. Uh, a few a few things to start off with. So I know a lot of people come to this. I'm an herbalist for plants, but the first part of this class will not be talking about plants. It will be discussing the variabilities and the considerations in mental health before we go to the main parts of anxiety, depression, etc. Uh, yeah, sorry. I need to get my screen bearings on. So the first part of this class um, will just be on the considerations about mental health, because there's no way you can just give a substance for mental health and expect it to work for most situations, certainly not for most chronic situations. So as somebody who does a lot of consultations with people, I want to initially go over some of the ways to help mitigate some of these emotional crises, emotional health issues, mental health issues, um, as somebody talking to somebody else, the counseling aspect of this. This is absolutely an overambitious class. It should This should probably be broken up into 3 or 4 separate classes, but I'm going to be going away after this for a couple of months. So I wanted to cover a bunch of mental health issues today. So it will easily go over 2 hours. You're welcome. Of course, it's being recorded. I will try to post it soon after, whatever time you get tired of listening to me talk. Let's see. I just wanted to mention as well, I'm going to be teaching in the Canadian Kootenays. That's Eastern British Columbia at the last weekend of June at the Kootenay Herb Conference. So that's something you can look up if you're interested in attending. And this is a very Canadian summer for me. I live upstate New York. I live in Ithaca, New York. Uh, and I'll also be teaching in Nova Scotia in July in the Nova Scotia area. So if you're interested, just follow me on Facebook or Instagram, and I'll post when those classes are, what days those classes are, and what times those classes are. Um, Brief bio. My name is Seven Song. I am a Russian Jew. Um, and I say that because people often think I am different ethnicities than I am. And a lot of what I've learned about doing mental health work and being an herbalist is my work at the Ithaca Free Clinic. If you're interested, you can go online and look up the Ithaca Free Clinic at Ithaca. You can look up Ithaca Free Clinic. And I've been working there for 19 years, and all the medicines are free, consultations are free, which is something I've always wanted to be a part of. And fortunately, a clinic in Ithaca opened up. It is not my clinic. I work at this clinic. Um, and part of the reason I'm saying this is it's open to anyone, wherever you live. We do telehealth. The one caveat is we do not send medicines. Medicines are free if you can pick them up, but we don't send medicines to anybody for any condition. It's a bit harsh, but it would be too much for us to send medicines, both in cost and in just time. All right, I think that's enough of introduction for me. Well, just one or two more. A lot of information that I talk about, I have handouts for on my website. My website is sevensong.com. And if you're there, you can also see that I have recently put up a database with lots of herbs on it. The database is very far from complete, but it is free. I made the database initially. I'm laughing because it's gone so overblown from what I expected for the reasons I was putting it together initially. So when I'm at the free clinic, I'll be seeing somebody and they'll say they have a certain kind of headache, and I think everybody gets into a stuck pattern where you just start using the same herbs over and over again. So I wanted to have a place where I can, look up headaches and think, oh, right, I never use this herb, or I don't use this herb, I don't use this herb. And so I can incorporate more plants. That's the purpose for me, but kind of it's a book in bullet point database form. I think that's the very beginning. So what I want to do, as I mentioned, is go right into considerations of working with people. First, I want to say that there's no great word for this. Like mental health, tricky with the word mental in it, emotional health, psychological health. So throughout today, I'm going to be using the term mental health because it's the most common term used in the circles that I'm around. I hope that's not a triggering word for you. There's just no perfect word for all the things that encompass our mind and body and beyond. And so mental health will be the term that I use. Of course, we all have mental health, right? I mean, some people have it, but some people's mental health has more aspects to it that, that disrupt their quality of life, both physically and mentally. So we can just start there. So if we're talking about depression or anxiety or brain fog, these things don't just affect how we are at the moment, they can absolutely affect our physical body, i.e. fatigue or restlessness, as well as the quality of our life. So, and there's acute and chronic with all of these. So for some people, I mean, everybody has mental health crises at certain times. I would just assume most people have that. And for many folks, it will come and go, right? So basically, it's the loss of somebody you care for very much, and then you grieve, which is a very natural and helpful response. But for other people, this might go on for weeks, months, years. And it's not, I mean, I'm sad about loss in my life that happened years ago, but it's about how it affects us and how we can move forward and how herbs and other exercises can help us be healthier. So mental health is a quality of life issue. Um, it's very, very common uh, in all aspects, all kinds of folks. I mean, everybody has this. There's no wealthy people are never depressed, for instance, though people who are marginalized and disenfranchised, they lack resources. So if you have more money, if you have more resources, it's easier to reach out. And of course, it's easier to find comfort. So I do want to point out that there's a disparity there, right? That if you don't have resources and it's already things, if you don't have resources, there's already more stressors for you. And with those stressors, you might not have any access to medical care. So you might not have access to regular asthma medicines. And so that way your lungs aren't working properly, which can also put you in a state of mental health crises at times. So I just want to point out that everybody has uh, all these are all these things that I'll be talking about today are common amongst many different people, all stripes of life. But some people, it hits harder for lack of resources. The next thing I want to use is the word stress. So stress is probably one of the most common words I hear in the clinic. It's actually a very ambiguous word, and it's very individualized what that means. For stress, for somebody, it could be a minor inconvenience. For other people, stress can mean on the verge of a panic attack. So often when people, as a clinician, talking to clinicians, one of the things that's very helpful is when somebody says that they have a lot of stress, it's often asked, I find it helpful to ask them to define what stress means for them. I might use different words than that because I want to know how to help them. And there's no herb for stress. There's herbs for the symptoms that accompany stress. So stress in general tends to mean that people feel overwhelmed and out of control. I mean, that would be one definition of the term stress. Stress affects, like all mental health issues, stress affects both our physical and our mental health. And it's helpful to have exercises, just like simple breathing exercises. I want to say when I tell people to do breathing exercises when they're under stress, a lot of people I work with have complex PTSD and other associated triggering problems. And you don't have to close your eyes, right? So I want to say this because for a lot of people, stress has from violence in their past. And so asking somebody in an office even to close their eyes and relax could be triggering for people. So you can say, take a deep breath, but you can keep your eyes wide open or open as you like. Okay, I think I'll do one now. You take a breath, you breathe out, and it's relaxing. So it's just another tip. While there's many studies on mental health, it's actually all the descriptions of how chemicals interact and neurotransmitters and hormones. When I'm using herbs, I don't really think about it so much. So I might ask somebody if they're on an SSRI medication, which one, to give me a sense of what their diagnosis is if they don't know it. But I don't equivocate. I don't try to match an herb to what people think is a neurotransmitter dysfunction. In other words, if somebody's on an SSRI, serotonin might be considered the problem, but I think mental health is way more complex than putting it into neurochemistry. And so I think while it's helpful to know, but I'm not really always thinking what herbs are going to increase or decrease acetylcholine or serotonin or norepinephrine. So those are just more considerations for this. All right, I get so thirsty doing this. Cheers. Next, I want to discuss safety, working with people and the safety involved in working with people. So there's more potential triggering, more potential upsetting people when working with mental health issues. And so I think it's just really important to understand that part of the healing process is the consultation, right? So it's just a part of it. But if you're a listening person and you're understanding where this other person is, you're understanding this other person a little bit and use language, body language, voice language, you can help mitigate it a little bit, or at least you can help that person understand that you are hearing them and that they are in a safe place. So that alone, I think, offers some feeling of betterness for many people. So I just want to say that again, that the consultation itself is important when we're working with people, whether we're herbalists or psychiatrists. I don't really know about other folks. I work as an herbalist. A few other parts about the consultation is I like to let people know that they do not have to answer any questions. And of course, the voicing in that is very important. So saying to them is, I have some questions for you. If they feel uncomfortable, just don't say anything and we'll just proceed from there. So again, offering this person some boundaries for them to feel comfortable. And almost above all, maybe a big part of it is confidentiality. Confidentiality provides trust, and trust provides safety. So you can express that things are confidential, but I think that there's ways that we talk and interact with people that kind of give a sense that confidentiality is a part of the discussion. But if not, I think it's important. In the clinic here in Ithaca, if I would usually say something if I know the person. So if I know that somebody comes in who I know from social situations, then I'll pretty much always say to them, everything here is entirely private. When we meet each other the next time in any public avenue, I'll say hi, we're friends, but I'm not going to ask you any questions about your health. If you want to discuss it, that's an option maybe, but yeah, but things are private. A few other ideas kind of in this early concept. It's important to understand people's access to finances and resources when you're working with them. So it's easy enough to say to folks, maybe counseling would be appropriate. I mean, for many, many people I see, counseling would be appropriate, but often counseling is not financially available or just not resource available. There are inexpensive counseling options in Ithaca, but they're often very full. So if you're offering counseling or if you're offering herbal medicine or any other suggestions, it's really important to check in with the person's resources first and just ask if this is something that's practical for them, because otherwise you're just adding stress, right? There's that word again. You're adding something to their current dilemma that doesn't bring any appeasement. Yes. All right. Next. So I hope this is making some sense. It's a little bit rambly as usual. But really all of this is to say, we're sitting there talking to a human being, acknowledge them as a human being, acknowledge their conditions, be a good listener, and watch yourself, like watch your language, watch your body language. Like when you're looking at somebody, I'm going to get off the counseling thing in a moment. When you're looking at somebody, they are looking at you, right? And so if you're like all tight and listening to them, or they say something, and you show it in your face. I mean, there are times you will show stuff in your face, but it's better to have like a neutral or just a caring face, whatever. Maybe I'm trying to demonstrate a caring face here, and just letting people know things are okay. I want to change that. That was a crazy statement. Things are not okay. It's just letting people know that I'm there to listen to them and to help in any way I can. Much better statement. Next, herb-drug interactions. I'm only going to spend a few moments on this. This is a very big topic and one that's very inconclusive. So the majority of people I see at the free clinic are on medications. So the first thing is to be non-judgmental about people's medications. There are many places to be judgmental. I have so much judgment. I mean, just ask me about politics, right? But I'm not judgmental about people's medications. Here's why I'm saying that. It's important because many people, even still, are embarrassed by being on medications, often particularly on being on psychiatric or psychological or mental health drugs like antidepressants, anti-anxiety, that whole realm. And maybe they view me, somebody with long hair and a weird name, and think I have a lot of judgment about herbal medicine, which is just not true. About medicine, excuse me. So I think it's more in action than saying something, but I want people to feel comfortable telling me the medications they're on, and I want them to feel comfortable to tell me if they want to, whether they're helpful or not helpful. I don't consider my job to get people off their medication. That is not why I'm an herbalist. I'm an herbalist to help people with however they want to be helped in whatever instances and ways they want to describe it. So if they say they want to get off medications, that is something to explore. So I'm going to say this, it's kind of a bold statement, and it's going to probably be a little contentious. So I have found that many herbs interact well with a couple of groups of these mental health or antidepressant medications. So it's really important to know, though, if you want to make sure, so if the antidepressant medication is helping them, so they're taking Paxil, and then you ask them, is Paxil helping? And they say, it is. I used to be more depressed or more anxious. And then you might ask the question, well, why do you want to use herbal medicine? They might say something like, I would like to see if it can help a little bit more, right? So it's important to know that if that herb is going to interact with the medication, that the person is aware that it could actually decrease it. It doesn't happen often, but it could decrease it. And all of a sudden they're moving more slowly and back into a depressive state. And it's because of the herb. So I would just talk to people, bring awareness that herbs can interact with medications, and then, spend a moment discussing what those implications can be. Again, drug-herb interactions is a very large discussion. This is just a little piece of it. My experience, that herbs have interacted well with many of the SSRIs. I'm not going to name specific medicines. You can easily look those up. I have found that herbs often interact well with SNRIs. I have found that herbs often interact well with some of the atypical antidepressants. But I am very cautious with the benzodiazepines. I'm worried about either an add-on effect or an add-off, or a decrease in the efficiency of those stronger medicines. I am particularly concerned about when people are on the antipsychotic medications. Because those have a very big say in it. If they're stabilizing a person, removing that stability could be very problematic for them and people around them. So I'm not saying, for each person, all these groups, many different people come to see me. It's a very strong discussion about medications, but I just want to be clear that the goal is not to get people off medications. but to use herbs that help them in whatever form, and just discuss the ramifications of herbal medicine. I have like 1,000 notes on patient compliance. Let me just say the most obvious. For most people, herbal medicine is weird, right? It's these bottles with this writing, these droppers that you have to ingest that have a lot of flavor. So what I would say consider for yourself is, what's it like to take a current pharmaceutical? What it's like is taking a tasteless capsule or tasteless tablet, putting it in your mouth and swallowing it. Now consider what it's like to make a tea or take a tincture, all the flavor involved, all the more add-ons. So we're going to talk about it with specific health considerations, but for each group of people, different for anxiety, for depression, for brain fog, it's really important to understand ways to increase the person's ability to take the medicine if that's what they want. So you give them something. Now, how are they going to take it? What are your dosages? How much? What forms? And the frequency of these herbs. A little more water, a little more talk. Next is assessment and diagnosis. So in general, most people like myself, herbalists, unless you're trained, are assessing rather than diagnosing. Diagnosing means giving a specific diagnosis, saying that person is bipolar, saying that person is irritable bowel syndrome. So I don't want to go into the differences so much, but I want to say, when you're working with somebody who comes in for any of these considerations, the question is, are you assessing them, or are you working with the diagnosis that they already have? My suggestion is both. So they come in and they're on antidepressants and they say they're depressed. They've given you important words about what's going on with them, but I would ask for their symptoms, pretty much always. There's very few diagnoses, when somebody comes in, whatever medical diagnosis, that I don't want to know what their symptoms are. And the reason is, as we move into herbs, is that herbal medicine plants often work on kind of more specific symptoms. So they might, if somebody has a lot of anxiety, some herbs are better for people feeling overwhelmed. Some herbs are better for people feeling spacey. Some herbs are better for people who don't want to get out of bed. So while all those could be put under the rubric of anxiety, I'm looking to know what it means to the individual. Sometimes it's very hard, though, for people to voice this for all the reasons that mental health can affect how we think and how we voice how we think. So again, just with assessment, diagnosis can be helpful. I will ask people sometimes for their diagnoses, but often really what I'm working with is their symptoms. Next, this is pretty important. Mental health, anxiety, depression, and other mental health issues can make physical health worse, but also physical health can make mental health worse. So what I want to do is I want to go over a list of some of the common things, I'll go over this list, that can increase mental health. Here's the very important part of that. Sometimes we're over-focused with things like anxiety, depression, sleeplessness, brain fog, when the problem is due to something else. And until we find this, I'm not talking about the root, well, I guess I am talking about the root cause. But I'm trying to figure out, is the mental health at least partially due to the things I'm about to mention? So we're not in that phase now, but first, COVID really increased it for a lot of people. So first, just having respiratory distress or just being scared in the world and having all these different opinions jumbled at us about COVID, about vaccinations. So I'm not taking a stand here. I'm just saying there's a lot of information and we have to suss it out ourselves. So COVID brought a lot on, and a lot of that still exists. And so things like a lack of privacy for many people because they couldn't get out of their homes, isolation for other people, breathing difficulties, worried about their jobs, just the depression and anxiety. So with COVID and other diseases, you have the infection, the virus called COVID, and then you have what it does and how it might isolate an individual and what that might do, and just looking at those avenues. Next, hypothyroid conditions, including Hashimoto's. Depression is often an aspect, and with people, particularly with Hashimoto's or any hypothyroid, until you treat the hypothyroid, the depression will often linger. It's just a part of having slow basal metabolism due to an underacting thyroid. And the next is the opposite. Hyperthyroid often leads to anxiety, nervousness, and irritability, just like not being able to sit still. So again, without treating the thyroid, you're having raised metabolic activity, which is creating mental health conditions. Next is Lyme. So Lyme, because of whatever it is, creates cognitive dysfunction, very common. Memory impairment, difficulty with coming up with words, are common effects of Lyme, as well as depression and mood swings. So it's hard to kill Lyme, right? Once that bacteria is in the body, that's hard to kill, but you can still work on other aspects of the Lyme to see if you can help get the mental health back up. Lots of medications create depression. So when we get to depression, I'll cover a few of them, but there's a very long and very well-known, very well understood list of drugs, medications, pharmaceuticals that create depression. Some create anxiety. I've seen that with steroids in particular, but more depression is a very common side effect. One of the problems with pharmaceuticals creating mental health issues is often they come on slowly. So you're taking a medication and 3 months later, you realize how depressed you are, and it's hard to associate it with the drug that you took 3 months ago. So as practitioners, one thing to do is ask people about medications that they've recently started. By recently, I mean a couple of months previously, to see if that might have an effect on them. And then, of course, recreational drugs, which is a weird word. I'm not really sure what to call them. Illicit seems weirder. But, non-pharmaceutical agents, particularly alcohol, but many other substances that people imbibe in order to feel better, many of them lead to depression and anxiety as well. Point is, look at outside sources that people are putting in their mouths. Even things like foods, many food intolerances can lead to depression and anxiety. It gets complicated, doesn't it? Pain. Chronic pain will often cause depression because you're trying to suppress, right? If your body is in chronic fatigue or chronic, fibromyalgia or just chronic headaches, the person often pulls in and less interacts with the outside world, and that leads to depression. So you're going to be focusing on those situations and what you can do to relieve pain, for instance, that can help with depression. So those are just some of those. And I think we'll get into it now. Have a sip of tea. Cheers. See you in Canada. And now I have the Canadian anthem in my head. I didn't even know I knew the Canadian anthem. I'm not even sure it is the Canadian anthem, but it's not the things from South Park. It's not that one. All right, everybody. I want to apologize also. I'm not going to be answering questions. I'm going to try to get this done. I hope that first part was helpful. I really, having worked in the clinic for all these years, I've just really seen how important all the pre-herb is. Consultations and patient advocacy and patient education. I did a bunch of free online classes for this. They're easy to look up about consultation. But I'm just, mental health is not somebody comes in, they have anxiety, and I give them Tulsi. I mean, even if the Tulsi worked, you sitting down with that person could create a better, safer environment for them that might also add a layer to them feeling better in the world. Hopefully, right? It's just one thing to hope for. Next, or first, anxiety. Has anybody following? There was about a month ago that that meme, TikTok meme with the word anxiety in it. I kind of enjoyed that one. So I didn't watch it on TikTok. That's for younger people, I think, probably no longer. I'm more of a YouTube, Instagram person, and you didn't need to know any of that. So anxiety is really one of the most common things that I see everywhere, right? Whether I'm working in an encampment, whether I'm working within one of the nations, whether I'm working in the free clinic. I went to Burning Man years ago. If you're interested in my opinion about Burning Man, I wrote a blog about it on my website, which is I went to Burning Man, so you don't have to go, which is pretty mean, but you can read it. It's in humor, of course. But what I'm saying is, pretty much every time I do anywhere, I work anywhere, no matter what the group of people are, anxiety is really prevalent. Often when people come to the clinic, they don't come to the clinic for anxiety, but anxiety will often be brought up, and I might ask about it. So they might come in. I mean, it's not every time. I'm not trying to force people. I'm not trying to force anxiety memories into people, but it's something that's it's sometimes easier to treat than other conditions. Like if I'm working with somebody who has something like fibromyalgia, fibromyalgia can be very complex to work with. So I might not be able to get to the root cause of the pain emanating from their body, the sensitivity and pain, but I might be able to help them feel a little bit better, right? So often I'll ask if there's anxiety or depression or any other issue that I can work with. And it's pretty uncommon where people will say, no, I feel fine, or they might say, I feel depressed. I want to take a moment and just say that the majority of people that I see who are on antidepressants are on antidepressants for anxiety. They're not on for depression. There are anxiolytic drugs, benzodiazepines being one class of them. But really, a lot of the people taking SSRIs, while they're called antidepressants, often what they're treating, which sometimes they treat well, is anxiety and not depression. So anxiety comes in many forms. The word stress is often like the code word for anxiety. And then I kind of divide anxiety into two major groups. One group is some people, when they get anxious, they get flighty and can't focus and fidgety. And the other group does the opposite. They start to take control of their environment. They start to take control of people around them. So they go into a very controlling state, and other people go into a very uncontrolled state. There's really no herb that I know of that will push one, make one worse. So in other words, if somebody's doing one, and I give them an herb that when I go over the herbs, I'm going to say that some of the herbs I use for one group rather than the other, but it's rare that the herb given to the other group will make the situation worse. It's just might not be as amenable to that individual. And so anxiety, of course, is a continuum. Anxiety ranges from momentary, like really nervous about something, to a debilitating quality of life issue, where anxiety just is a part of everybody, is a part of your life, moment to moment. It's very unrelaxing. And of course, it affects things like concentration, it affects sleep, and other things it often affects the ability to listen and respond well. Especially in both of those groups, one group being more flighty, the other group being more controlling. But the group that's more controlling often has very active mind. They're often thinking, I have to do this, I have to do this, I have to do this. And in both situations, it becomes more difficult to listen to the people around you. It just becomes more difficult to be a good listener, which I think just interrupts quality of life a little bit more, as it pulls you back from interacting with your community. So there are two or three main groups of herbs that are helpful for anxiety. I would put them in, if these are a continuum, of course. The continuum means they start light and go to heavy, or the opposite. They're anxiolytic, nervine, and sedative. So we'll start with sedative. Sedatives are plants that, when taken in larger amounts, or if you're a more sensitive individual to these plants, they will sedate you. They will decrease your awareness. They might make you tired. They might make it more difficult to do your job or to do something that needs concentration. So generally with the stronger sedative herbs, I'm going to use them when the person does not have to, they're not involved in more elaborate tasks. For instance, maybe later at night or before they go to sleep. That said, often these sedative herbs in smaller amounts can be used throughout the day in the next category that we talk about. So the next category are called nervines. Nervines are plants that the goal is to kind of restore proper nervous system function. In other words, maybe reduce some triggering, reduce some excess brain activity or thinking activity, and just bring a sense of calm to the person, but often over time. So where sedatives often have a more immediate action, you're in a really bad situation, you're getting on an airplane, you have a lot of fear of that, you might take a sedative herb to like just bring you right down. But for many people, the goal is to just feel less anxious on a day-to-day basis. And for these, the nervine herbs can be really helpful. But again, sedative herbs taken in smaller amounts can also act as nervines. So these are the two main categories. The last category are called anxiolytics. That just means anxious reducing. And so both of those can fit into the camp of anxiolytics, meaning they can help reduce anxiety. And people have very individual reactions or sensitivities to these plants. I know some people, for the majority of people, I know passion flower is a nervine and they can take it on a very regular basis. It doesn't interfere with them. But somebody I work with, if they take any amount of passion flower, it's very sedating to them. So it's just important to realize how these things affect people individually. So you can ask, it's a tricky question because, I'm going to move off of this. It is a tricky question. So again, when you're working with people who are anxious, consider, are they getting proper sleep? Without good sleep, anxiety can be on the rise. Maybe you can help with that. Pain can put people in an anxious state. Hyperthyroid, food triggers, and then the obvious, caffeine and other stimulants. And we all know people. I know people that can drink coffee at 10 p.m. and fall asleep at 11 p.m. So that exists. Other people, it just doesn't work for them. They drink it at 9 in the morning. It's their last cup. It's decaffeinated, and it keeps them awake until the next day. And so it's just trying to work with individuals. Some of the symptoms of anxiety is feeling overwhelmed, busy mind, panicky, restlessness, inability to concentrate, spaciness, increased heart rate. There's a bunch. I think that many people have probably a pretty good of what anxiety feels, at least to yourself. But yeah, for a lot of people, it also becomes difficult to make decisions. What should I do? What should I do? So some herbal treatments for anxiety include breathing exercises. Again, it doesn't have to be super deep breaths. You don't have to be sitting on a mat in a comfortable air conditioner, whatever. It could be anywhere at any time. I tell this story frequently because it worked. I had a patient and I made a label for them. This is me making a label. And the label said, breathe 1 deep breath a day. And they put that on their purse. They put the purse in their bag. And then once a day, they would come in every couple of weeks to get herbs. And they would take it out and they would see it and take 1 deep breath a day. This, of course, is called harm reduction, right? Maybe it's called harm reduction. Whatever it is, it's, people don't have to go to the extreme. 1 deep breath a day is 1 deep breath a day. So that's one. For some people with anxiety, being spontaneous could be helpful. And for other people, regulating and doing things in schedule could be helpful. So that you just ask the person if, if there's some way, you can do that with the herbs. You can take herbs spontaneously as needed, or you can take plants on a very specific schedule, 3 o'clock, 5 o'clock, and 8 o'clock. For some people, doing things on schedule brings a sense of calmness. For other people, that increased scheduleness doesn't allow for any creativity and spontaneity. It's individual. You can look at reducing stress triggers. This is often difficult, right? Because a big reason for anxiety is the state of the world today, right? It is not, I mean, parts of it, of course, are very calming, beautiful, and relaxing. And then there's the political sphere of the world and degradation of our environment. I am not going to go on. And so there's little you can do about that, but sometimes you can find ways to reduce small stress triggers in people's lives. Meditation is a consideration. It could be an active meditation, walking, or it could be sitting. And you don't really even need the word meditation, just ways for people to move off energy or to kind of ground themselves. Exercise could be helpful for people. Again, it could be from any range of very simple exercises to more complex things that make you use up a lot of energy. And I think for some people, helping people form community and networking, if that's a possibility, can be helpful. I think a lot of people feel isolated in the world. And I think knowing that other people feel that way, I think in person is better if possible. But I think most humans are social animals. And so I think helping them, I mean, we don't have specific groups at the clinic for this, but just discussing the possibilities with people. All right, believe it or not, I'm going to talk about some herbs. First, I want to go over some of the sedative herbs. So again, in large amounts, all four of these plants can often really kind of bring people down, reduce their mental energy, reduce their physical energy, and potentially can help sleep. Sleep we'll discuss later. And they are hops. Hops works great as a tincture, and it works great as a glycerite if you try to avoid alcohol. So I'm not going to go over all the forms of the medicine because I won't be able to get that far in this class. But sometimes I'll just mention that some plants, I think people don't think of as a glycerin and might be adverse to alcohol, and that glycerites don't have alcohol. They don't bring on any alcohol effect. So hops really works very well also to take in small amounts during the day. The next herb is kava, which is kava. A good preparation of kava, it's probably the most inebriating out of all these herbs. By inebriating, if you think about what alcohol might do to people and where you're kind of a little bit ditzy, larger amounts of kava will do that. And with this ditziness, I think, well, it might not be the best for social interactions. It often means like your brain is just less focused on the present, or let me change that. Your brain is just more, I don't know how to explain. I probably can describe this well. I have this another class I did previous about kava. It just means you're less focused in many ways. And it just allows things to go in and out. It's actually in small amounts. I would say that kava is one of the better ones for people who have social anxiety. The dose is the difference. So it's like alcohol has that. Alcohol, of course, can be much stronger. So it's not a great comparison. But I think for some people, getting into a new situation and just want to relax a little bit and not be so tight, I think small amounts of kava tincture is one way to take it. Capsules work, but it's hard to time them. And then, of course, there's anyway, that's one use of kava. The next one is skullcap. Skullcap is the lightest of all of these. Skullcap has a lot of skeletal muscle relaxing. So skullcap is particularly good when anxiety creates a lot of stress or tightness in the body, often the shoulders and neck. But in itself, it is also just relaxing. And in large amounts, it could be a little bit sedating. But out of these four herbs, I think it's the safest as far as not being overly sedative for most people. And the last of this is valerian. Valerian is probably the strongest of the sleep herbs, but again, valerian taken in small amounts throughout the day could be an excellent, just gently relaxing herb. But valerian is just one of those, like all of these, like valerian, skullcap, kava, and hops, is you get home, you want to just sit back and watch Resident Alien, and your mind is just way too full of stuff, and you can't enjoy doing that, or you can't just enjoy a conversation with somebody who's you're close to. These might be good herbs to try. Again, the dose is the difference, and your sensitivity and individuality will play into that. The next is a very long list of nervine herbs. I'm not sure why this is. I think, actually, I don't know why. But in the land of herbal medicine, there's lots of nervines, and I suggest trying them, many of these out for yourself, giving them to other people. Most of these are very safe. Frankly, the other 4 herbs are pretty safe, but these seem safer. They don't have nearly a sedative effect to them. So just so you know, every time I talk about herbs, they're in alphabetical order by their common name. So there's no other order to this. I have an alphabetical mind for some reason, so I like that. So the first herb is blue vervain. Blue vervain is Verbena hastata. And blue vervain is one of the best herbs. These are all some of my best herbs. There's no best herbs on these lists. Blue vervain is one of my favorite herbs for tight anxiety, for overactive mind, for intrusive thoughts, for thoughts that go in a loop. Got to do this. I'm worried about this. I'm worried about this. And it just goes over and over again. Again, it's not sedating, though. So you might couple it with a more sedating herb if it's really overactive. So I would say if you have busy mindedness, that blue vervain is helpful. All of these nervines are often helpful to take, though, throughout the day consistently, right? So for some people, blue vervain will work right away, but for many people, taking it 2 to 3 times a day, 1/2 dropper to 1 dropper full, often in combination with other herbs, will work over time. And in some ways, while it's really nice when things work quickly, over time feels great. Over time feels great. That's a weird thing to say. What I really mean to say is, well, you ask people how anxious they are in the clinic, and you give them a 1 to 10 scale, and they say, I'm anxious 7.5. And then they take the herbs, and so you see them 2 months later and say, oh, I'm at a 6. Really, any number under. It could just be a coincidence, but it's more like that, bringing down the algorithm of numbers. So I like it. You can drink it as tea. It's just pretty bitter. I'm not going to go over but most of these herbs are in the yucky category. I mean, when I say most of these herbs, I mean most of the herbs that I use medicinally. The next herb is California poppy, which is Eschscholzia californica. I like using the whole plant, roots, flower pods, flowers, and leaves. This is parts of the plant that I like to use. And I would say California poppy is just a really nice, mild nervine herb. While it has the name poppy, there's 0 opiates in it. You will not test positive in a drug test after taking California poppy if they're testing you for opiates. There's no opiate-like substances, though it is related to the opium poppy. It just doesn't have that. So I do want to say one thing about preparation. I find California poppy way better as a fresh tincture than a dried one, and I double macerate it to make it stronger. I find California poppy weak. I find that if I double macerate the fresh plant, you can look up in other places what that means, that it makes it stronger. And some people do find it helpful when you're trying to reduce the reliance on often recreational medications. So that's a consideration. I'm not sure because it has the word poppy in it, but some people I've met have found it helpful, and so that's good enough for me. And it's a very safe herb. So it's a mild nervine that can be taken over a period of time or really large amounts for a stronger effect. The next herb is catnip. Catnip works really well when nervousness affects your gut. So you're the person that when you get anxious, it's all in your belly, right? You can't eat, or you're nauseous, or you feel full, or really any kind of gut stuff going on. That's where catnip works its charm. It's it also has mild sedative properties. It's the opposite of what it does to cats, even though cats tend to fall asleep in it with time. Um, so, but since there's much to say about every plant, I'll just say a little bit about each plant. The catnip is just great belly herb, great belly anxiety herb. The next herb also is a great belly anxiety herb, but a little bit stronger, and that's chamomile. So chamomile, matricaria, chamomilla, or matricaria recutita. Yeah, it's really hard for me not to say botanical names. I'm a botanist. So uh, I've met more people, we'll talk more about this in sleep, but I've met more people that have said that chamomile tea helps them fall asleep than almost any other herb, even though it doesn't fit into the sedative herb category. But chamomile has lots of positive attributes. It's easy to find, it's inexpensive, the quality is often good because it has high turnover in stores. It's well tolerated, except if you're allergic to it. And people just know it. It has that placebo effect. If I say to somebody, and this happened just last week, I have some chamomile for this. And like, oh, chamomile. It's so nice to hear that reaction, like, oh, chamomile. And it's like a little bit of letdownness, even though there is a little bit of letdownness when you just, when you even mention the herb, because in their mind, they're correlating it with that. And there is no reason not to have positive correlation. I mean, that adds to the effect. And chamomile also makes a great glycerite, makes a great tincture. It's great as tea. But it's also, again, it's a great when your belly is anxious or inflamed. It works really well. It's just a general excellent nervine that, unless you're allergic to it, for many people find it's helpful over time, taking it on a regular basis. The next herb is Damiana, Turnera diffusa. Damiana is a little bit stronger than these. A strong cup of Damiana tea for some people will make them a little bit less focused. So I tend to use Damiana more when people are more tightly strung, when they're anxious and their body is holding tension. They're often doing this. They're interrupting sentences because they have a lot going on in their mind. I find Damiana really helpful for all those situations. I like the flavor of Damiana. If you make Damiana tea, don't steep it for too long. It goes from tasting Damiana-like, which is I like, to just being very bitter and pretty generally unpleasant. So if you can make Damiana as a tea, don't steep for too long. Damiana makes an excellent glycerite, as do most aromatic herbs. And Damiana makes a really good tincture. So you have a bunch of ways to use it. If it doesn't have any odor or smell, it's probably not useful. It's probably just really old Damiana. So I'm a big Damiana fan in all of its forms. The next herb is linden. Linden is Tilia species, sometimes called lime flower, though it's not the lime that people eat. It's not the fruit. It is not the lime fruit. But it is sometimes called lime flower. So it's Tilia species. Linden is another excellent relaxing nervine. It's not very sedative. You can use it for any category. People get more spacey or fidgety, or people more uptight. It works really nice as a nervine. It also is a pretty nice heart remedy. So if you're working with somebody who's anxious and has had heart problems, it's a really good herb to add. The flavonoids seem to be helpful for nourishing the myocardiocytes, the heart muscle cells. So linden is good for that. Yeah, I'm a big fan. It also tastes good. I mean, linden is one of the better tasting herbs. It makes a good glycerite, tincture, and tea. The next herb is tricky. I'm going to talk about it just a little bit. One day I'll probably just do a whole class on it. And it's lobelia, which is Lobelia inflata. Lobelia activates or gets involved in the parasympathetic nervous system. Lobelia helps engage the rest and digest part of us, as opposed to the sympathetic nervous system, fight or flight. And lobelia by itself has a relaxing effect in the body, but the reason I'm mentioning it now is I consider it one of the stronger herbs to increase the efficiency of other anxiolytic herbs. So if you're giving almost any herb I mentioned so far or in the future, if you add a small part, like a 1/5 part of a formula of a tincture, that's the way I mostly use it, of lobelia, don't use lobelia as tea. It's very acrid. Um, it'll often increase the efficiency. So lobelia has lots of uses, but one of the uses I really like it is I'm giving somebody some herbal, I'm giving people nervines, they're working and not quite enough. And sometimes I'll just add a little bit of lobelia to the medicine and it increases its efficiency. I don't think it increases it via bioavailability. I think it increases it by doing more interaction with nervous system transmitters or receptors, more in that realm. The next herb is mimosa. Mimosa is Albizia julibrissin. And it, once again, and we're going to talk about mimosa again with depression. Mimosa just has a very gentle, relaxing effect on people. I use the bark. I know people use the flowers, but I haven't been able to gather any yet. Gathering the bark is much easier because I don't live around the plant. So mimosa bark is just something you can take on a very regular basis. I want to make one very important distinction, but mimosa bark can increase the mania in bipolar. So if you're working with people who are bipolar, and they might be in the manic stage, which has an anxious effect to it, I would just avoid mimosa. I would just avoid mimosa in anybody who is bipolar. That would be the easiest way to do that. But otherwise, it's a really helpful herb. It feels very nourishing to the nervous system, frankly. Like without being very specific for what it's for, it's one of those plants that's just really good for anxiety and depression and seems to help people cope better taking over time. The next plant, remember there's a lot of, this is the longest list of any lists today. The next plant is motherwort. Motherwort is better, can be taken as anxiety is risen. So in other words, as needed. And motherwort, probably it's more specific, again, it can be used for either kind of anxiety, but if it feels like your heart is racing, whether it is or not, if you're having heart palpitations that are not severe enough that you need medical treatment, then motherwort really works great. So if anxiety is associated with a racing heart rate, then I suggest motherwort. It does not bring down the blood pressure, right? It just relaxes the body. So motherwort is just really helpful in those circumstances. Many people I'm around really like it premenstrually. So if they get anxious, and again, racing heart premenstrually, they find motherwort very useful. Many people have said this, so I would suggest it for that as well. The next nervine is oats. Oats is a Vina sativa. I'm sorry to be inconsistent with botanical names. And I think most people really like the milky oat top. So you gather the fruit of oat straw when it's fresh and you blend it when it's fresh. And there's a latex that's held within that fresh fruit, the thing that's eventually going to be an oat groat, that works. But dried works okay as well. But I tend to use the dried tops rather than the dried straw, which also has medicinal attributes to it. Oats is probably the gentlest of every tonic I've mentioned here. If you're somebody, I mean, and its classic use is burnout. So you've worked for a nonprofit organization. I don't know how many of my friends this has happened to, and still, you work for a nonprofit organization, you're trying to meet goals all the time. People have very different opinions about everything. And you get burnt out, and it's hard to get a replacement for you in the role that you're doing there, when probably you should have stopped doing that a while ago and done something else. But I'm making it very specific. But another place, especially for folks like myself or older, is taking care of relatives, which is a very stressful situation often. And so in both of these, oats can be helpful during and definitely after, but for long periods of time. You could drink the tea or you can take the tincture. But again, a little like mimosa, but more gentle than mimosa. I would say that oats is just one of the most nourishing plants to the nervous system. I think it's just mineral rich, and those minerals somehow interact again with neurotransmitters, neuroreceptors, nerves themselves. But very few people would not profit from drinking oat tea, or really, frankly, eating oats at times. But that's more nourishing for the GI tract. All right, getting all this information. I hope so. Hopefully, this is being recorded well, and then I'll post it later. Just a few more for anxiety. So the next one is passion flower. I particularly am a big fan of passion flower. And it's one of my favorite, along with blue vervain, for people that just have intrusive thoughts, they can't relax, they have difficulty listening, they have constant worry. And the worry is replaced by the next worry, right? So they're like, as soon as this is over, I will relax. But as soon as that is over, and maybe before that is over, something else has filled that place that creates chronic anxiety. One word for this, not really a friendly word, but I like the word worrywart. I also like the word worrywart because wart means plant. So I don't know why there are no plants called worrywart, because that would be worry plant, just like mugwort means plant in the mug, maybe. Anyway, so if you have worrywartitis, I think passion flower with many of these other herbs that I'm mentioning could be really helpful. It's not a great tea. It's pretty musky or musty in its flavor. The tincture works great. The glycerite works pretty good. So you do have some options for these. Many of these plants also work in capsules. I don't use as many capsules. The next is many people's favorites, but not everybody's favorite, and that's rose. Rose, again, fits into this general nourishing the nervous system. Many people have good relationships with the rose. They like the smell, they like the flavor. The glycerite is delicious. The tincture is not bad tasting. The tea is also very tasty. There's other forms of rose you can use. So it helps relax people, especially over time, but sometimes as needed, just because the flavor of rose, you can ask people, by the way, not everybody has positive associations with rose, but if they do, it's a very common one in my classroom for students who are feeling overwhelmed to just take a little bit of rose glycerite. I think just the taste of it also just makes people feel good. It's just, if you like rose flavor, it's just delicious. So yeah, and I think, if I would say rose is good for both. But because rose, hello Rose, because rose is so gentle, like some of these other plants, it works really well for people who are anxious, but very sensitive to herbs and medications. So I didn't go through like oats would fit into this as well, and chamomile would fit into this. So some people are just very sensitive to substances, to herbs and drugs and drinks and foods. And for these folks, things like oats and chamomile and rose work well because they're just more subtle, or they just they're just they're just good for sensitive people. They don't seem to invoke any adverse reaction. So that's rose. And one of the main ways I use rose is I use rose glycerite to make many of the other tinctures taste better. So I'm giving, most of these things don't taste very good. I'm giving some motherwort, some catnip, I don't know, some damiana, and then you put some rose glycerite, and it helps meld the flavors a little. It makes it taste a little bit better. So that's another use of rose. The next is Tulsi. It's hard to believe that these are just nervines. The next is Tulsi. Tulsi is Ocimum tenuiflorum. There's other species of basils, of ocimums, that are helpful as well. So Tulsi is similar to rose, is that it really is nourishing. Even very sensitive people tend to have very positive responses from Tulsi. I tend to like Tulsi more for spacey and flightiness. So for people that when they get anxious, the thoughts just fly out of their head. They barely know where they are. I mean, I'm exaggerating. Barely know where they are, and they're very fidgety, very hard to sit still. very hard to bring up thoughts in their mind. And it's not because it's overactive, it's because it's scattered, right? That's the word I probably should have been using all along. Kind of things get anxious, things get scattered, hard to make a decision, not because there's too many decisions, it's because it's hard to find out even one choice to make. So for this, I find Tulsi very helpful. It also makes a very tasty glycerite, if you like basil taste, a good tincture, and a great tea. So Tulsi is really helpful, very good for sensitive people like chamomile and rose and oats and some other ones. One more in the Nervine category. Whew. Let me do a little aromatherapy. I'm going to smell a Japanese lilac. Delish. All right. So our last in this list of nervines is wood betony. I find wood betony very helpful, kind of a mid-range, like more like somewhere around Damiana range for people for anxiety. So I tend to use wood betony more for people who have overactive minds, too many things going and circulating in their minds. And I particularly like wood betony, which is Botanica officinalis, formerly Stakey's Botanica, and many other names. I really like it for people who have troubling dreams. It's just like a classic use. I'm not really sure if it does that, but it's a classic use of wood betony, and I give it to people for that reason, to see if they just, if they just sleep better throughout the night. But I don't think it's a very strong, it's not very sedative. But it's just one of your classic, people wake up, they feel anxious, it's hard to get through the day without all these thoughts going through, and it's hard to relax, it's hard to listen to your compatriots. So I am just suggesting that wood betony is another excellent nervine. I've been using this one for about 5 years now, kind of recent, and just really get great results. People often want more of it. I have one more plant under anxiety, and this is specific for panic attacks. So anxiety attacks and panic attacks are different. So anxiety attacks are when all of a sudden you feel very anxious. A panic attack is when that anxiety reaches a level that incapacitates you. So if you've ever been trying to do something that frightens you, and then all of a sudden you freeze, like hardcore freeze, and you feel like you can't, like, you are just stifled with fear. And so, of course, there are situations where that would be expected, but I'm just speaking about things that might not be that. The phone rings, right? And so anemone, which I talk a lot about in all my classes, is just really helpful as needed for panic attacks. It's just, if you have panic attacks, I suggest carrying anemone tincture. I only use the fresh plant tincture. It's the only part that I found useful, and trying it out. I mean, sometimes it's hard to find in the market. I make my own. I don't sell herbs. I don't send herbs, but I just like to have a big supply of anemone. But you don't need much. Anemone is a low dose herb. It's not dangerous. Just 5 to 10 drops a few times during an individual panic attack for some people will really help a lot. So anemone for panic attacks. It's just one of the, what is it? I often think of it as a gateway herb, because when it works right away. And so it's not so much a question, like a lot of herbs, like, did that motherwort help? Did that oats help? Did that hops help? But anemone tends to work as you need it right there. The panic attack can lessen considerably. And so then people have more trust in herbs, which I do like, but it's also not my objective. All right. All right, I'm doing all right on here. How y'all doing? Ding, ding, ding. Let me know. Thumbs up, thumbs down. More herb 7 song, less herb 7 song. I'll read a few of these. I'm going to take a moment, breaths here. The more herbs, the merrier. I do like plant medicines. All right. Whew. So as a not warning, uh, anxiety is probably the most complex out of all the things. So, I just went through a bunch of herbs for anxiety. You can just try out the ones that seem most helpful for you or for other people around you. Most of them are pretty safe. If you avoid the sedative herbs, usually people are not going to have a sedate reaction, but let people know that it's always a possibility. There's a few herbs I didn't mention. Yeah, there's a few herbs I didn't mention. There are many herbs that are relaxing herbs. So I think we'll move on to the next. So the next is depression. So depression, like anxiety, is very common. It often has overlap of symptoms, though. So both anxiety and depression, like previously, I said that many people are on antidepressants for anxiety, but part of that reason is, again, there's a lot of overlap between anxiety and depression. For instance, sleeplessness or inability to concentrate. And it's not so easy. So I'm going to go into some of the symptoms, but sometimes the symptoms are not obvious, and lots of people. So I'm not talking about bipolar here, where there's very big mood swings for many people between depression and anxiety. I'm just talking about people who are not bipolar and go back and forth within the course of an hour, within the course of a day, within the course of a week. So let's talk about some of the risk factors for depression. They include genetics. It often runs in families. Biochemical. Situational. Some situations will increase depression. And environmental. In other words, it's just not one thing. I'll talk about medications in a little bit, but many, it just runs the gamut of why people are depressed, from the family, from their situation, or just the individual chemistry of their body. There are specific types of depression. I'm not going to really go into them. When I go into the herbs, I'm just going to mention some of them now. Often medically, when somebody's called depressed, they mean major depressive disorder, which has very strong parameters, or it has medical parameters. How many days a week, how often it happens. I don't follow these parameters. There's bipolar disorder, which depression could be one attribute to that. There is seasonal depression for many people who, when there's a lack of light and it's cold, but often the lack of light is a big part of it. There's premenstrual dysphoric depression or premenstrual dysphoric disorder, PDD or PMDD. This is a form, so PMDD is a more heightened or more acute form of premenstrual syndrome. So premenstrual syndrome can also have depression, but premenstrual dysphoric disorder tends to have much more acute and often, frankly, much more longer lasting throughout the month depression. It's hard and it can be very difficult to treat. And then you have postpartum depression, which is very prevalent. I just know lots of folks who, after giving birth, had long-standing depression afterwards. I don't know the chemistry behind it, but unfortunately, it's common. Some of the symptoms of depression is a general lack. You could just almost stop there. It's a general lack, right, of things. So anxiety, we can say, is a condition of excess, right? Excessive thoughts, excessive mood, excessive irritability, excessive emotion. Where depression is a lack of all those same things. So more of a lack of emotion, a lack of engagement, long-term sadness. So again, we always have to separate. Like something happens to you in your life that creates sadness. That is a potentially very helpful response. But for many people, it will go on and linger on and create quality of life issues. So other symptoms of depression is a lack of interest or lack of pleasure, things that give you pleasure. Food is often one of these things. So many people at one point in life really took pleasure, whatever they ate, whatever food brought enjoyment, and now it doesn't bring any enjoyment at all. Kind of this gray zone. Other aspects are apathy, not caring. Fatigue is very common. Getting out of bed can be very tedious, even if you sleep a lot, and we'll talk a little bit about that. Inability to concentrate, often very foggy-headed, is a possibility. Hopelessness, changes in appetite. And you see both changes in appetite common in depression. For some people, they will start to eat more and more, even without feeling a pleasure with it. And many people will eat less and less. Then you have things like less desire to interact with other people, which can further the depression. As mentioned previously, of many humans, social interaction, positive social interaction, is a big part of feeling better. And I think this lack of social interaction, this lack of being around people, this lack of wanting to be around people, is a feed forward to this. Poor self-esteem is often a part of depression. And then it can become suicidal thoughts, suicidal ideation, suicidal attempts are definitely a part of depression. If you're working with somebody and that's something they bring to you, I would really consider what your next step should be in order to keep that person safe, who you should interact with, how you can get help for them in a very safe, patient advocate way. I'm going to just list some of the medications and drugs that worsen depression. I just stopped at one point listing them because there's so many. So first, alcohol, benzodiazepines, Valium, Xanax, opioids, antidepressants can make some people's depression worse. That's not something I've read. That's something you see pretty regularly. Levothyroxine for people who are taking thyroid hormones, beta blockers for cardiac problems, stimulants such as cocaine, MDMA, methamphetamine, all those things lead to depression. Anticonvulsants like gabapentin, and it's switched to a new drug. Like there's always a new drug that is being used for everything. I would say about 4 months ago to the previous 4 months before that, there was so many people taking gabapentin for all things that I was not accustomed to. But anyway, gabapentin can cause depression. And then corticosteroids, steroids, and contraceptives, hormonal contraceptives. So it's a short list of things. So the point of all that is to ask people if they're on these things and then talk about it. I mean, you can't just take people off their medications, right? Unless you're working with them long-term, you have medical expertise there. There's a few treatment considerations with depression that could be helpful before we get to specific herbs. I like adding, if the person likes warming herbs, meaning eating herbs, spicy herbs, I like to add it to their formulas. So when I go over, it's usually just like 1/5 of a part or less of their formula. But I feel like that warming stimulation helps like invigorate the body a little, because depression has this whole inward feeling, and we're trying to open up a little bit. So there, hopefully. So here are some herbs that you can put into people's formula. My favorite is cayenne pepper. When you make a cayenne, you can make cayenne glycerite, delicious. If you like me and love spicy, you can make a cayenne tincture. Before you give it to people, taste it, right? Because some, like depending on the pepper and the preparation, some cayenne peppers will blow out your nose and others are rather weak. So after you make a cayenne preparation, or if you buy one, see how strong it is and decide how many drops will be put into somebody's medicine. You can also use horseradish, which is really plentiful all around here. It's gotten very weedy. That's stimulating. Black pepper. And then some that are less spicy, like turmeric, cardamom. And then your carrot family members. You have dill and cumin and coriander, kind of a bunch of kitchen spices. Spice things up a little bit in the medicine. So I'm more a fan of like cayenne pepper, but all these things add a, excuse me, add kind of a more warming element to the medicine. So yeah, there are things to consider. When you're working with somebody who's depressed, you really want to think about how they're going to take the medicine. So if motivation is lacking, one of the things to consider is how are you going to take the medicines? One way is to just keep it at the easiest place to find it, maybe on a bedside or next to the bathroom sink. So, and then asking people. So right now, I didn't do this with anxiety, and I'm going to combine treatment considerations, what I'm talking about right now, with anxiety and depression, and you can fit into all the other topics. When you're working with people, whether they're anxious, depressed, or brain fog, ask them very clearly what preparations would work best for them. Tea, tincture, glycerite, explain what they are without going into too much detail. And then ask them what works for you. Here's a very important differentiation. For some people, I mentioned this with anxiety, for some people, they need a schedule. So I'll say to them, would you rather take these herbs as needed, or would a schedule work? And they'll say, I need a schedule work for me, whatever words you use. And so that schedule will be, if they're taking it twice a day, then you say, okay, take it at 2 o'clock and take it at 6 o'clock. For some people, this really works well, having the schedule. Other people are way more open to spontaneity. So you can say, so they're taking small amounts of hops for nervousness. And you can say, well, you can take it regularly as a nervine, but also you can take it as needed. You can take a half dropper full as needed to help calm yourself. Does that work for you? For some people, it does. For other people, it does not. So when you're doing this, I'm talking about this because we're talking about treatment considerations, is to ask, can I make this work for you? A very important aspect is how frequent they're going to take it throughout the day. There are people that I'll say, this would be most helpful if you take this 3 times a day. Can you do this? And then you don't just listen, you watch the response. And some people will say, yeah, I think so, but it's kind of a no. So you just ask, you say, well, how about just twice a day? And they go, okay, that sounds better. In other words, you work with your patients, work with the individuals. So I use the word patient, but work with the people you're working with and just ask them what works for you. Because if you make it complicated, for many people, they won't take the medicine. So that has to do with preparations. It has to do with how much they take, and it has to do with the frequency of how much they take it. With things like depression, you might want to ask, where will it be most accessible for you to take when you're not feeling well, or how to take it throughout the day. So I hope that makes sense. Yeah, I hope that makes sense. Some herbs for depression. The herbs in here are not for depression. What's happening here? The clouds are coming in. It's getting pretty rainy looking, which is not a surprise. It has rained so much this spring. We've had like 4 days of sunshine, but plants are green. I'm inside. I'm not sure what else to say about that. Here we go. Many of these herbs have a bit of spiciness to them. And the goal of this spiciness is kind of to warm them up, or just like, I don't know, feel something in their body. Again, they're in alphabetical order by common name. So the first plant is calamus. Calamus is Acorus calamus. And calamus is mostly good for brain fog. It's not a very motivating plant. It's more for helping clear the mind and focus and concentrate, which we'll talk more when we talk about brain fog and cognitive dysfunction. But it also is stimulating. So it's bitter and aromatic. And so calamus just kind of gets digestive juices going, which I think also helps with depression. I think it just kind of has a gentle uplifting effect, but a better mind clearing effect. The next herb is ginseng, and I use the American ginseng, Panax quinquefolius. And I think it has just, all right, first I should be clear. I have not used a lot of ginseng for depression. I've used it a few times where it's been helpful, but with other herbs, I've just used them more often and have a better assessment of them through use. So, but ginseng for a lot of people also just seems to be a classic or a slow-moving antidepressant. It's not a lot at once. It's small amounts as either tea, tincture, or glycerite, but it has a gentle uplifting effect. It has kind of an all-around body effect. Um, Again, partly I don't use it because I'm careful with the amounts that I have because it's so expensive and hard to get. But also it's just an herb I'm still working with depression. The next herb is lavender. Lavender is whatever species you have that you like that's aromatic, lavandula species. I want to say that I didn't mention it, but lavender is also an excellent anxiolytic or good nervine herb. So lavender is both antidepressive and helpful for anxiety. But it's another one that it's harder for me, with anxiety. I tend to, I don't know what I'm doing. I'm discussing anxiety. Anxiety, I put into these separate categories. With depression, I tend to have one more main category. So when I'm describing the individual herbs, often they're fitting into like a holistic kind of all those different symptoms that I mentioned previously without being as specific. But lavender, I just find this uplifting, so helpful for depression. The flavor is also uplifting. Um, it's not so much mind clearing. It's also good for sluggish digestion. So I think in general, lavender is gently stimulating in the body. It is uplifting, and I think the smell and flavor for it is really helpful there. Uh, I use lavender a lot. Lavender makes a crazy delicious, crazy means good here, a crazy delicious glycerite, and it makes a pretty tasty tincture. Uh, but go slow with it. It's usually a small amount of a formula. It's very stimulating, lavender. And so I tend to have it like 1/4 or 1/5 part of a formula with it. The other thing you can do that I haven't mentioned is you can definitely make sachets with many of these plants. And then instead of taking stuff internally, you can put them, you can put them in a little bag, one of those little cloth bags. This is an eyeglass cleaner, and then just crush and smell, right? So you can take lavender, you can use the essential oil, but sometimes it's something really nice about activity in depression. So you get a sachet, you put lavender or whatever plants you want, crush it and smell it. Or there's those little essential oil rolly things where you have a material in the inside and you put some lavender on that and you kind of just sniff it. And that could also be very helpful. What I'm trying to say is aromas can be very helpful for many different health conditions, and depression, they could be very uplifting, and lavender is a really good one for that. The next one is lemon balm. Lemon balm is often used for like mild to moderate depression. But I haven't found it as, so I'm just going to say this. I haven't found it as effective. I used it a lot because often it was just one of the most commonly considered plants for depression. So I like lemon balm best for people that has been very long-term depression, where I'm looking for a very slow change. I'm not expecting a quick change in depression. I'm looking for a much slower alteration. What am I looking for? I'm looking for the depression to help get better over the course of weeks, basically. There, I sometimes find lemon balm effective. I've used it a lot in the past, hoping for quicker change, and I don't find that with the plant. Lemon balm makes also a great glycerite, makes a good tincture, makes a tasty tea. But yeah, I think long-term chronic depression, lemon balm is helpful. The whole beginning I said about it is I felt a little bit disappointed. All the things I heard about lemon balm and all the people I gave it to, I didn't find its results as good as some of the other herbs. And I feel like I have pretty good preparations for it. The next is lemon verbena. This is totally a personal choice. I just think lemon verbena is the lemoniest of all the plants. I don't think it's anything specific for depression, but if I'm making a tea with some of these herbs for depression, I'll always throw lemon verbena. It's very safe, and it just has a very uplifting smell and flavor. So I don't really use it for any specific chemistry in people's body. I like lemon verbena, is really what I'm trying to say. And but I can put it in anybody's teas. I think it's particularly effective in depression because of its sprightliness. The next plant is maca, or lemon verbena, is Aloysia triphylla. The next plant is maca. Lepidium mayennii, maca root, and maca is different. There's going to be two plants that fit into this category. Maca is gently stimulating. So I will use maca in depression in order to kind of get the person more physically stimulated to do stuff. I mean, maca is often talked about as an aphrodisiac or something to get your freaky sex on with, or non-freaky. I don't want to be judgmental here. So, but really what it is just stimulating for some people. It seems relatively safe for most folks. It doesn't tend to have the excessive stimulation of caffeine that a lot of people get from caffeine. But I think in general, maca has a gentle, and if you take it regularly, stimulating action that just helps people get more motivated, just more physically motivated with their depression. So, fan of maca. The next one is rhodiola, which I always want to sing, but I cannot sing despite my name, to the tune of Oklahoma. So rhodiola, do it in your mind if you like. Rhodiola is similar to maca. Maca and rhodiola I often use together because they're both body stimulating and a little bit mind stimulating. So if the person with depression has a really hard time getting out of bed, if they have a hard time moving around, if they feel very lethargic, so if the depression has a large sense of lethargy associated, then two plants that I really like for that are maca and rhodiola. And often you can take a little bit as needed, but it's really both of those herbs are just better to take over time. Once, twice, 3 times a day, often inform them with other herbs. The next herb is rose. I think rose is a very uplifting plant. I think, like another plant I mentioned, I forgot what it was already, like Tulsi maybe. I just think that rose is good for depression and anxiety. I think it's not just the flavor. I think the biological activity of rose helps with depression. I think giving it on a regular basis helps with depression. And it's something I see in the clinic. Again, often I'll put rose, I might have another formula, might have maca and rhodiola and a few other herbs, but often I'll just put some rose glycerite for both the flavor and also to help with the depression, the biochemical activity of the plant. Just a few more for depression. And the next one is going to be rosemary. I am just all of these plants, right? But I just find rosemary very stimulating. I find it helps invigorate the thinking process. It's a strong antioxidant, which I'm not really sure fits into the depression for a lot of people. But I find that just giving people rosemary, kind of in the calamus realm with this, over the course of time with depressed, seem to be less muddled in their mind, less foggy thinking, and more able to concentrate better, focus better, take in information better. And I like rosemary, another great glycerite, as in so many aromatic plants. Good tincture, tea. I usually use a small part of it, though. Rosemary can be very stimulating. It's a little bit like some other plant, like lavender. Lavender and rosemary, I just have lesser parts of them in formulation. I just find I don't even know what I mean by stimulating here. They just seem too strong. That's a better word. They seem strong, and so I dilute them in the preparation. But rosemary is just really good for lots of people to help mental clarity over the course of time, including in depression. And just one more for this. And this is a little bit like lemon balm. So the last herb for depression is going to be St. John's wort. And I felt like, again, like lemon balm, I've been disappointed with St. John's wort for depression. So I find it in one place that it's really helpful, and it's really the same place that I find lemon balm helpful. So I find it best for like what would be called chronic depressive disorder or just long-term depression. And like lemon balm, and often combined with lemon balm, I find St. John's wort helpful if you're looking for that long-term recovery, then I'm going to use some of these other herbs, though, that tend to have more symptomatic effects, more to have a little bit of uplifting sooner, but that long course of helping with the depression. St. John's wort and lemon balm often combined. St. John's wort, the problem is its combination with other medications. It's kind of the poster child of herb-drug interactions, which is a whole other conversation. Otherwise, though, St. John's wort is very safe, as lemon balm is very safe too. So that's a list of antidepressants. Well, that's I'm sorry, I speak too much without thinking. That is a list of herbs that can be helpful for depression. I really think antidepressant is a whole other word than herbs that are helpful for depression. Speaking of, little aromatherapy. It's amazing. These are Japanese lilacs. Sip of tea, look at myself, watch the grading process in action. I'll answer this one question. So my tea today, Sarah, is it's some nervines, mild nervines with nettles, because I'm drinking nettles these days. It's a pretty mild tea. So mostly I need it before I start. I mean, I'm going to say this to encourage people. I still get a little bit anxious and nervous before I give a class. And so I tend to drink relaxing teas before teaching. And hopefully the class isn't that long, so I don't have to pee before the class ends. All right. By the way, another thing, there's a lot of by the ways in my life, a lot of caveats and a lot of by the ways. There's lots of people giving information in the chats. I'm a non-censorer, and I'm glad that people are, but I have no idea what they are. And you will have to use your own discretion from what people are saying in the chats if you want to trust that information and use it. But you're welcome to give it. I just want to be really clear that I'm not sorting that information out. I am not vetting that information. Brain fog. I don't know why I said it so happily. Brain fog. Brain fog. So brain fog, the other name for that is really cognitive dysfunction, is a series of symptoms. It's not a medical description. Your doctor will not tell you, I mean, a good doctor might say you have brain fog, but basically it's a group of symptoms, and it generally implies, excuse me, impaired memory, difficulty with concentration, difficulty with focus, and difficulty with finding the right words. It's really common. Many things bring on brain fog, as I'll discuss. And it's just really, I mean, I just said this. It's really common. Lots of people come to the clinic and they use a whole bunch of words to describe what I would call brain fog, and just the inability to be present, the inability to concentrate and focus, and really often the feeling of losing memory. In brain fog, both the in and out functions don't work well. It's often hard to take in information, and it's hard to distribute information, to say information. So it's, things can get very muddled. They're very different kinds of muddling. You can have kind of an anxious brain fog where things go in, but it's just like ping pong balls are flying all over the place, and it's just a few more ping pong balls in there. And other people, it does feel like fog. It feels very thick and heavy, and like no more information can penetrate. So the herbs are a little bit different for both of these, but both of these would be considered different brain fogs. It can definitely, this brain fog can definitely interfere with quality of life, being present, being around people, social activity, and just, daily activities, because you're forgetting what to do. You're not doing things as well. You're not present when you're doing things. These can be all problems with it. Of course, it could be temporary. I'm sure everybody has temporary brain fog. But for many people, it's long-term. It was during COVID, it was along with anxiety and depression, it was one of the most common effects that was not about their lungs or some like physical organ. Many people felt it, but again, often isolation and all the other social aspects of COVID brought it on. So here's a list of things that can contribute to brain fog or cognitive dysfunction. A lack of refreshing sleep, infections and disease, Many infections, Lyme, COVID, but many times after getting an infection, the brain is fuzzier afterwards. The aging process, anxiety, depression, an uptick in stressors, loss in one's life, travel, especially travel that you're not enthused about, medications, recreational substances, allergies. That little laugh is because there's many things. Thyroid disorders, both hyper and hypo, and lack of physical activity. That is a very partial list of things that could create brain fog. So like everything else, like with depression and anxiety, when you're working with brain fog, can you help with something else? For instance, if brain fog is due to refreshless sleep, not having refreshing sleep, can you help with sleep? If brain fog is due to pain, can you help with pain? Thyroid disorders, maybe it needs medication, maybe herbs can be helpful here. Food triggers, looking at the food. In other words, instead of just going right to the herbs to help the kind of the mind get clear if possible, it's like, what is the underlying cause? But even when you don't know what the underlying cause is, often you can still try to treat symptoms. There's no reason not to do that. The reason I say that is often, especially in the early days of me studying herbal medicine, people would always talk about treating the root cause of disease. It's great, but often not easy. So, and even if you're trying to treat the root cause, why not help reduce the symptoms while you're doing that so the person just has a better quality of life during the course? All right. So I have less of a list, and I just want to say that there's one plant that gets talked a lot about, bane frog, that I haven't used yet, and that's Bacopa or Brahmi. So Bacopa monnieri, or the plant, one of the plants called Brahmi, I don't have experience with yet. It's just on the list. There's lots of other plants, so it's not going to come up, but I do hear people talk about it. So these are herbs that I feel I see helpful that I have used regularly. The first are 4 herbs that often I use in combination, and I've just found really helpful for helping people focus and concentrate. So I'll go over them separately, and then often I use them in combination. The first is calamus. I don't think there's any herb that helps people get more of an immediate effect of focus or concentration than calamus. So calamus, Acorus calamus, is really helpful for as needed focus. Of course, it doesn't always work. It's only treating a symptom at the time. But I always have bottles of it. So I run an herb school, right? So let me talk about the herb school for a moment. So I run an herb school called the Northeast School of Botanical Medicine. There's an advert placed in the middle of your class. My school is in person. It's in Ithaca, New York, Northeast School of Botanical Medicine, sevenzone.com. I'm only going to run the school a few more years. I've been doing it for 34 years. I'm going to get to the point soon. But if you're interested, if you think, if you like sarcastic, cynical, non-spiritual herbal teachers, consider my school. Consider Ithaca, New York. So the reason I'm saying that is many of the students have a really hard time focusing for a long period of time, just like most humans do. And so there's always a bottle of calamus tincture somewhere in the class, calamus tincture, calamus glycerite. So it's for people that space out easily, but don't want to space out, right? So, I mean, there's times to space out. It really, even this class, like even we're going towards 2 hours, it's a lot of time, especially with a computer. There's very little stimulus. There's not other students with their packaging noises around you, making little sounds. So what I'm saying is, particularly on a computer, it can be really helpful. But even in a classroom, if you teach, and it seems like a safe environment for people, I would bring in calamus. Again, those strong flavors, I think, help it. And I think there's some chemical action in the plant that helps with focus for it. So it can be used as needed. Also really long and really helpful for long term. Somebody just wrote, I would say many could use calamus. But I really would say is if we lived in a different world where things weren't so pressured and tight, we would need less calamus, the way that my school runs and many other schools. Lots of information at once. Shut up, Seven Song. Talk about herbs. Next, ginkgo. So ginkgo is also helpful for brain fog. Not so great as needed though. So ginkgo is a plant that helps with memory and concentration, but more memory over the long haul. So if you're going to use ginkgo, just know that probably going to take it for weeks to months before you're going to notice any kind of difference. It probably has to do with how it affects cerebral brain vascularization, blood going to the brain, and maybe blood leaving the brain. So ginkgo, part of what it does is the flavonoids seem to strengthen blood vessels. And so one attribute that ginkgo might have is helping the blood vessel health in the brain, going back and forth into the brain. But there's many other attributes that ginkgo has. So ginkgo is a really great one for long-term concentration, memory loss issues. But really, you're not gonna notice a difference, really for weeks. And so just prepare or make your own medicines and know that you'll be taking them for a while, and there'll be a subtle improvement that improvement can continue for a while. The next one is Gotu kola, Centella asiatica, sometimes also called Brahmi, Centella asiatica. This is a little bit more similar to ginkgo. Gotu kola also seems to help vascularization of the brain, maybe like helping blood flow to the brain, and might have other attributes, like physical attributes, helping with people. But what it's good for is for focus and for, I'm starting to fade a little myself here. Gotu kola is excellent for memory. And it's good for memory for long term. It does many other things, but your ginkgo Gotu kola combination is really helpful for memory loss after something like traumatic brain injury, looking at other aspects of traumatic brain injury, and also difficulty with concentration after stress. So you were just taking care of some people that was very difficult for a while. You finished it, you feel burnt out, and you also have a hard time with focus and concentration. You're looking for the long-term development of restoring those capabilities. They could be very helpful. And that's it. It seems very safe. Ginkgo might have some problems because it might decrease platelet aggregation. So you might want to be a little bit cautious. Be cautious with ginkgo if you're on any kind of blood viscosity medicine. If you're on any medicine that alters the thinness or thickness of your blood, which are often anticoagulants or blood thinners, be cautious with ginkgo. Do your research. Just ginkgo, not Gotu kola for this. And the last of this quadrad is rosemary. I've already mentioned it. Rosemary seems to help cerebral function, memory function, concentration function. And its antioxidant action probably has some aspects of this, helping clear away some detritus or broken down blood cells in the body, maybe in the brain. But it's classic that rosemary for memory is an old school poem or an old school line, old school idea. But I agree with it. I think rosemary is good for memory. So we have 4 herbs that are the primary herbs that I consider helpful for brain fog. There are calamus, which is one of the only ones that really seems to work as needed. And we have ginkgo and Gotu kola, which are long-term, might help with cerebral perfusion, blood flow. And then rosemary as a strong antioxidant. These 4, I find them just really excellent, used in combination with each other for a wide variety of cognitive dysfunction from whatever source. The most common source, though, is something that's happened and has changed cognition quickly, whether it's COVID, Lyme disease, a physical accident, a brain accident, a head accident. I often give these. People find them helpful, this combination. So it's really something, the biggest consideration with this is the ginkgo, and if they're on blood thinners or any other blood viscosity medicines, be cautious. And calamus is just really strong tasting. I mean, many people can't get calamus now, flavor-wise. So that's the combination. I'm going to mention there's a few other herbs to consider for brain fog, but I don't really want to go into the details. We're moving towards 3, and I'd like to finish in the next half hour or so. But we have insomnia after this. And so these are other herbs to consider. Most of them are adaptogens, right? I'm not sure why I'm saying it like adaptogens. Say it with me. Adaptogens. So the idea of adaptogens is in my mind, I'm just going to think that how I say it each time. So the concept of adaptogens is that they help your body adapt to stress, right? So the daily grind, whether it's a change in your body that happened after an infection, or a change in your physicality, or excess stress in your life, or doing more than you previously done. The idea of adaptogens is very holistic in its sense. The idea is that your body, multiple aspects of your body start to function better. That's really what it is. But there's good reasons for that. I mean, they have different chemical bases to them to help the body adapt to situations, antioxidant, or working on neurotransmitters. Frankly, a lot of them, it's not very clear what specific chemicals are altering the body to help it. But really, I think they do often work to help the body adapt to new situations and stressful situations, and are great at recovery. So here are some of these herbs. So the first herb is ashwagandha. So ashwagandha is Withania somnifera. The next herb is chamomile. It's not often put into adaptogenic categories, but I think chamomile has adaptogenic properties. I think it helps the body cope with stress. The next one is Eleuthero ginseng, sometimes called Siberian ginseng. That's Eleutherococcus senticosus. Eleutherococcus senticosus. These days, it just tends to be called Eleuthero. It is a form of ginseng and another adaptogen. The next one is ginseng itself. Its biggest problem probably is just its price. It's very expensive. And of course, buy it from reputable sources, people who are growing it, not wildcrafting it at this point. So ginseng is Panax quinquefolius. There is a Chinese ginseng. This is the one that is native to the United States. The next one is maca. I think maca has a place for brain fog. Just be careful, it could be a little bit stimulating for people. And then we have the two herbs that often are not put into adaptogenic categories, but I would consider them both helpful for brain fog, anxiety, and depression, and many other problems, and that's rose and tulsi. So that's it for herbs for brain fog. Some non-herbal treatments would be counseling or other forms of therapy. Looking at food. I've met many people that have altered their diets and the brain fog has gotten better. And so it's hard to know what it will be. Will it be gluten or walnuts? I don't know anybody where walnuts is a problem, but I'm just saying it could be often left field where it's coming from. Sometimes lifestyle changes can help with brain fog. It's a very broad statement. Movement might be helpful, or the opposite, relaxation and meditation. By meditation, I just mean sitting still and letting your mind wander. And then sleep hygiene, as we'll get to in the next one. All right, folks, doing all right? We have one more category to go. I'll be the Alex Trebek of herbal medicine. Smells so amazing outside these days. We have at night, the Dames rockets just deliciously perfume the air. Right now, during the day, we have these Japanese lilacs around my house. It is a delicious smelling time of the year. All right. Last group of categories is insomnia and sleep difficulties. So in general, there's a medical definition of insomnia, and I'm just going to use the word a little more loosely, meaning a whole broad range of sleep difficulties. But some of those sleep difficulties, for instance, might be sleep apnea. And so sleep apnea will cause sleeplessness, but it's not considered insomnia because the primary condition is having difficulty breathing while you're sleeping. So what I'm trying to say is I'm going to put these under the umbrella of insomnia. So these are all going to be discussing I'm going to be discussing the different ways that people have difficulty sleeping. And the reason I put it under mental health challenges, though it's not considered specifically that, is that sleep difficulties just lead to all the above. So I want to make some suggestions for sleeping better to see if they can help people sleep better. I think it's almost nap time for me. So sleep difficulties affects both the quantity and the quality of sleep. Because I've met many people that get a full 8 hour of sleep, but wake up not feeling refreshed. That's the term that's often used. So the concept of sleep is when you wake up, maybe not immediately. Immediately you may be zombie-esque, right? But within a certain amount of time, that sleep should have refreshed your body so that you're ready for the next day. For many diseases and many mental health conditions, no matter how long people sleep, this is particularly true in depression, they might sleep for 10 to 12 hours, but wake up feeling unrested or unrefreshed. So these are some herbs to see if we can work with that a little bit and help people sleep better. Again, we're looking for both quantity and quality. I just want to mention that I read the book Why We Sleep by Matthew Walker. I listened to it. I didn't really care for it. So I found it alarming and kind of associating sleep with every possible disease on earth. So I don't know if anybody else read or listened to Why We Sleep by Matthew Walker, but I like parts of it are very interesting. He's a sleep researcher and I think a neurophysiologist or something. But I don't think I've ever read a book where everything is correlated to one thing, because I don't read that many books like that. So, but for him, like sleep creates really almost every disorder. So I found it problematic and I stopped about halfway. I'm just saying that if you've read that book, yeah. So there's basically two forms of insomnia that are common. There can't fall asleep and can't stay asleep. And so can't stay asleep has two of its own forms. One of those forms is waking up during the night and not waking up at like 2 or 3 in the morning and not being able to fall back to sleep. So bing, you're awake and your mind is active, maybe your body is active, and it's really difficult to fall back to sleep. The other is just continually waking and falling asleep. All these things could be together. So you have can't fall asleep, can't stay asleep, waking up once and not being able to go back to sleep, waking up multiple times during the night. So these are all different forms of insomnia that we're going to be talking about. One of the things, excuse me, I'm getting itchy nose syndrome. One of the things about insomnia and sleeplessness that I do agree with is that when you're awake, and even if you're only partially awake and watching this, maybe you're snoozing and watching this, when you're awake, you're in a sympathetic mode, right? The chemicals in your body are in a sympathetic state. You're in a somewhat fight or flight mode. I mean, it's not that extreme, but you're awake, you're concentrating, you're thinking. That's going to put blood more into your skeletal muscles, and it's more of an active way. Your body, when you go to sleep at night, you go into the most parasympathetic state, rest and digest, that you will find throughout your 24-hour cycle. So while you're awake, depending on how you're awake and what your activity is, you're in a more sympathetic state. While you're sleeping, you're more in a parasympathetic state, except for one part of your dream cycle, which we won't go into here. So why that's important is because your body could look for damage and repair damage better while you are sleeping. That's why often if you have pains, you wake up feeling a little better. This is not always true. Some things feel worse when you wake up, especially sometimes joints feel sore because you haven't moved them at all. But for general repair and blood distribution and digestive function, actually sleep is very important because while you're sleeping, your body goes into parasympathetic mode, your blood vessels relax and are able to kind of scout and locate and look around the body and repair. So that's important. Also, while you're sleeping, you go into a dream mode and your brain gets to sort data in some very weird ways. Last night, woo. Anyway, your dream gets dreaming gets to sort brain data. That's one concept. Nobody's really sure why we dream. There's some hormonal regulation that happens while we sleep. And very importantly, you have more immune system surveillance. So these are all important reasons for sleep. So a lack of sleep can have some pretty dramatic actions in the body. They include, of course, fatigue, just not feeling awake, difficulty with focus and concentration, which can lead to accidents, especially car accidents, sleepy driving. It can lead to both depression and anxiety, irritability, loss of appetite, and worsening of other medical conditions. So, I mean, I know just a few minutes ago, I said there's a book that is associated with everything, which I didn't agree with, but sleep refreshes our body. It's really how it is. And dreaming probably is an important aspect too. I'm going to name just a few instances or a few causes of sleeplessness, and then we'll move on to herbs. So not only does lack of sleep cause depression and anxiety create a lack of sleep or a lack of restful sleep. Often sleeplessness, there's no clear reasons. There's many medications that interfere. Stimulants like caffeine and cola can create sleeplessness. Drugs like alcohol. So I think most of us know, though, while people sleep well, will sleep deeply or sleep unconsciously, well, if they drink a bunch, depending on your resistance to alcohol or how your body deals with alcohol. Anyway, alcohol gives very unrefreshing sleep. So you will sleep, so it's helpful that way. You will knock you out, but the quality of sleep is pretty low. You also can have infants in the house that can create it. Actually, just noises and smells. Many people are just sensitive. And so, somebody banging around the kitchen at night might wake them up. Food triggers can create sleeplessness, restless leg syndrome, and then some medical conditions. So these are just a short amount. These are just a short list of things that can cause insomnia. But things like sleep apnea, hyperthyroid, GERD, or gastroesophageal reflux disease, stomach reflux, ADHD, and asthma are a few medical conditions that cause sleeplessness. In other words, many things make it difficult to sleep. And as we all know, just having some anxiety about something, just something the next day, actually even really positive things can cause sleeplessness because you're too excited and can't fall asleep. So lots of people who I see at the clinic have difficulty with sleeping. Sometimes herbs work really well. Sometimes herbs work moderately well, and sometimes they don't touch it at all. There have been quite a few people that we've tried over and over and over, and the strongest herbs possible that what I have, and it hasn't touched it. So this is true with everything I've said today, right? I mean, sometimes you can treat anxiety, and sometimes it's really difficult. One thing to consider with sleep is sleep hygiene. So sleep hygiene is a kind of a set of rules or considerations to help. So I'm going to go over just a few of these, but you can easily look up sleep hygiene. My experience is some people, these will work great for, and other people, it really doesn't make a difference. So here we go. These are some common ideas of sleep hygiene. Things to do to help you sleep better. First is limiting caffeine. By first, I just mean the first in this list, especially later in the day. If you don't sleep well, and even if you only drink 1 cup of coffee in the morning, see what happens if you don't drink a cup of coffee for 3 days in a row. Many people are so used to coffee that they can't imagine that it's causing it. But even small amounts for some people during the morning will do that. I have no idea of how that physiologically works, but I meet people that stop and they feel better. It's probably helpful to avoid exciting media, like watching movies before sleep. Blue screens, which all of these are, tend to make it more difficult to fall asleep. Reducing light exposure as it gets later in the night. Establishing a regular sleep pattern. And then there's just a whole bunch more. Here's what I suggest. Look up sleep hygiene, Wikipedia or wherever else you want to look, and just look at the list and see which of these things fits me and which is possible for me to do, right? Many people, have to work on the computer until they go to sleep, but really part of it is trying to reduce excitement, so light excitement, smell excitement, before going to sleep, to allow the brain to kind of move down to another level and to help tiredness setting. Some non-herbal treatments. One of them is white noise. For many people, this is really helpful. These days, of course, you can buy an app, or find an app that will have like white noise, whatever. You can find a sound that feels good for you. I know quite a few people, especially in warm weather, that will just have a fan near their bed, and the sound of the fan is just helpful. For many people, white noise is just restful. Taking herbs that relax your muscles. So many people, when you go to sleep, get tight. So herbs that reduce the tightness, herbs like black cohosh or particularis or skullcap, can be helpful if the reason you're having difficulty falling asleep is because your body is tight. The next are herbs that help reduce pain. Again, you go into bed at night and all of a sudden you can feel that pain in your lower back, or your headache gets worse. So all the herbs that can be helpful for pain can possibly be helpful for sleep. And then the last of these we've talked about, and we'll cover them again, which are sedative herbs. So I'll finish this list of herbs, and then we are finished with this class. Yeah, and thank you for being here. It's nice for me. I like knowing that there's some people that are actually listening while I'm talking. It makes it seem a little less sci-fi or something. That's not the best word for it, but here we go. All right. So the first 4 herbs I've discussed already, and we will discuss them again. I'm going to put them in the order of which I think are the best herbs to fall asleep to, and then we'll discuss them putting in formula. I think valerian is probably the strongest of the sleep herbs. So that's Valeriana officinalis. The one problem with valerian is a reasonable proportion of people, maybe 10%, 1 out of 10. When they take it, they have a negative reaction to it, an adverse reaction. So some people, when they take valerian, they get agitated, exactly what you don't want to happen. One thing you can do is, if you want to try valerian or give it to somebody, is to have them take it in the middle of the day. So that way, if it makes them jittery, they're not laying in bed hating on you for giving them valerian, right? So you have somebody like they've never tried it before, take it at 2 in the afternoon. If it makes them jittery, it's no fun at all, but it's way better than them taking it at 10:30 at night, trying to go to sleep, and all of a sudden they're jittery and can't fall asleep and just more anxious. Otherwise, so probably out of all the herbs, it probably is one of the better sleep herbs. There's discussion about whether it's addictive or not. I'm not really sure how to go with it. Some people need valerian every night to help them sleep, but many other things are important in life, and valerian just seems relatively safe to use. But some people do start to rely on valerian. You could try to wean off or try some of the other herbs. The next herb that I find really helpful for sleep is hops. Again, we talked about hops as a sedative. So hops is a sedative, and strong amounts of hops can be really helpful to fall asleep. It shuts the brain down a little bit, and it shuts the body down a little bit. So we're talking about, all of these herbs I'm mentioning right now. You can do anything from a half dropper full, 1 milliliter, to 2 full dropperfuls, 4 milliliters. I mean, or you can do much higher. So we're going to discuss taking these things at a higher dose in just a moment. The next herb is skullcap. Once again, skullcap is a little bit weaker, but skullcap is better for body tension. So it helps relax the mind a little bit, but also helps relax body. It helps your body relax. And the mind, but not as strong as hops or valerian. The next one is also quite strong, and that's going to be kava. So kava, depending on your dosage, could be used, like as we talked about, for social anxiety or for day-to-day. But taking a few dropperfuls of kava before sleep often it helps disinhibit well. And so by disinhibiting, it's just shutting off the loop in the brain. Also, it's a physical relaxant. It's a muscle relaxer. So kava can also be helpful for relaxing the body. My favorite combination for people who have very difficulty falling asleep, where nothing else has worked, has been strong amounts of hops, valerian, and kava. That's the combination. They're often in equal parts, and the dose is anywhere, right? Whatever the person wants to put into their body. So what I want to suggest now are there 2 ways to take these herbs for sleep. The first way is right before going to sleep. It's easier to bludgeon somebody to sleep with herbs than it is to help them sleep through the night, because your body will metabolize the herbs during the night. And so if you're somebody who wakes up at 3 a.m., by 3 a.m., those herbs are no longer active in your body. We're going to come to that in just a minute. So one thing to do for people, if you just can't fall asleep, you have an active mind, active body, body pain, whatever is causing it, is just drink a really strong amount of the medicines I mentioned. Usually tincture form. The problem, these are not great plants in tea, because some of them, like valerian, works better fresh, but also then you'll have to get up at night to urinate potentially. So hops, kava, and valerian, strong amounts, 1, 2, 3 dropperfuls before going to sleep. And it might make you wake up groggy, and then, so practice them on a day, experiment when you don't, the next day you don't have something to do in the morning, but it's uncommon. It's uncommon. I find that people wake up groggy taking them before going to sleep. Here's the other way to take them. So the next way to take them is if you wake up at like 3 in the morning and you just feel awake, right? And it's really hard to go back to sleep. You're pushing the pillow in all kinds of directions. You're trying to shut the brain off a little bit because it's active. What I suggest for that is get a cup. Doesn't have to be a very big cup, and put whatever amount of herbs, 1 dropperful, 2 dropperfuls, 3 dropperfuls of the medicine I just suggested. Of course, don't use valerian if it makes you jittery. And then put them in a cup with water, dilute it, and as soon as you wake up, like blink, reach over, so put it on a nightstand, reach over and drink it, and see if it'll have an effect. In other words, drink a really strong sedative sleep potion as soon as you wake up, before you go to the bathroom if possible, before your mind starts thinking, because if you drink enough of it, sometimes the herbs will have strong enough effect to kind of sedate you and help you help your body work back down and go into a sleep state. And really the amount is entirely up to you, like 4 dropperfuls, which is like a quarter of an ounce. Let's see, 2, 4, 6, that would be 8 milliliters. Would be very strong, but I don't know. But you might not want to start, that's a very strong preparation. You might want to start with something gentler. But the reason I say that is I know many people, this is a very common problem, is waking up during the night and not being able to go back to sleep, or really wake up at 2 or 3 and fall back to sleep at 5 and have to wake up at 7. And so it's just, the goal is to just see if we can get people back to sleep at 3. So you can bludgeon or just use a really large amount before going to sleep. You can use a bunch if you wake up during the night to help you go back to sleep. Or the last category is you sleep non-deeply. Like, so many things cause that, especially if you have been triggered in the past, you have any abuse in your past, which is common, and then you don't sleep deeply because of fear, because your body is in a heightened state. So that has some importance within itself. So with these herbs can help some people sleep deeper throughout the night. We've covered almost all of them previously. So if you're the kind of person that wants to sleep deeper, but you kind of, you wake up for a few moments, you fall back asleep, you wake up for a few moments, you fall back asleep, and you want something to help, neither of the sedative herbs are not the way to go. The nervine herbs are the way to go. And you take them regularly. So that whole list of plants, I'll name a few of them in a moment, is that you take them during the day, not necessarily at night. The goal here is nourishing helping your nervous system function better, where it goes into a more restful place when you go to sleep. You can combine these with sedative herbs. So you can also take, skullcap and hops before going to sleep to help you fall asleep. But long term, those herbs don't usually help you. The sedative herbs often don't help you get a steady sleep through the night. They help you fall asleep because they're going to keep asleep for a little while. So there's a whole bunch of herbs to take to help you stay asleep, but you're going to take them 2 or 3 times during the day for weeks or months. One herb is not an herbine, but helps people sleep, and that's ashwagandha. So ashwagandha with Withania somnifera, for some people, is a really helpful fall asleep and stay asleep herb, especially taken regularly. And then it's the whole other crowd. We have blue vervain, California poppy. One herb I haven't mentioned at all is cannabis. I just don't want to get into a cannabis discussion. There are many good sources of cannabis and CBD. So anyway, catnip, chamomile, damiana, passion flower, wood betony. That whole list I just gave you, that I said very fast, is the initial list of nervines. So whichever those fit into you best, I consider taking those if you don't fall into deep sleep, or if you fall into this wave-like sleep where you wake up and go back to sleep. So also you won't wake in the initial, eventually you won't feel that refreshed when you wake up in the morning. So a few more herbs to consider, which I've mentioned previously, is you can use muscle relaxant herbs like black cohosh and peticularis. Peticularis is the genus of the plant. So if your muscles are tense, those are helpful. Black cohosh, peticularis, and skullcap. And then if you just have a lot of pain before going to sleep, there's many pain herbs, but one herb I found particularly helpful for that is Jamaican dogwood, or Pisidia piscicola. So that, believe it or not, only 17 minutes over 2 hours, is today's class. I'm open to comments. I'm probably watch a few here and then get off pretty soon. You're welcome. I'm going to put this on YouTube and then put the link on my Facebook and Instagram pages. And if you want to leave comments about what this class was for you, I like reading comments. I'll read all comments because it's, if comments help me teach better, that's also a helpful thing. So if you've been here this whole time, congratulations. I hope it can be helpful for your anxiety, your depression, your brain fog, or your sleeplessness. And this is Seven Song, stopping the recording. Thank you again. I'm going to stay on for a little bit and read.